So now for the next orthopedic condition, we'll be looking at hip flexion contracture. Hip flexion contracture. Hip flexion contracture. And this is basically when the hips remain in a flexed position and cannot be fully extended. Okay. So look at this condition from the definition to the causes to the symptoms to the possible treatment of what? Hip flexion contracture. All right. So from the definition, we say that this hip flexion contracture is a condition where the hip joint remains in a flexed position and cannot be fully extended. Okay. So this results from what? It could be that there was structural changes in the muscles or tendons or ligaments around the hip. All right. So what are the things that follow on this hip flexion contracture? The causes is it could be that the person sat down for a very long time. You know, when you sit down, you actually flex your hip. Okay, so when you stood up, your hip cannot be extended again. Okay, so spending long periods in a seated position can lead to shortening of the what? Hip flexor muscles. So always exercise, always go around. Then spastic paresis. So conditions like cerebral palsy can cause muscle spasticity, leading to contractures. Traumas. It could be that there was injuries around the hip, and this led to what? Contractures due to what? Scar tissue formation and the muscle imbalance. Okay. There could be that there was weakness of the hip extensors. Okay. So it could be that muscles that are supposed to extend the hip became weak, and this contributed to the development of a flexion contracture. Okay. So what are the symptoms? Okay. There will be limited range of motion. So be difficulties in fully extending the hip joints. Pain. There will be discomfort and pain in the hip, especially when you are trying to strengthen the leg. Okay. Gait abnormalities. There will be altered walking patterns, and this is due to what? Inability to fully extend the hip. Okay. The postural issues. There will be poor posture and poor balance. Okay, and this is due to your hip flexors are short. Okay, so what is the treatment? So things like physical therapy, where you are stretching or strengthening. Okay, any exercise for stretching or strengthening can improve flexibility and muscle balance. Orthotic devices. So things like braces or supports can actually help to maintain proper alignment and prevent further contracture. Okay. Medications, things like pain relievers and muscle relaxant drugs can help to manage the symptoms. Okay. Surgical intervention. In severe cases, surgery may be necessary to release the contracted tissues and restore the normal hip function that way. Okay. So that's it for hip flexion contracture condition.